My name is Eric Diaz.
And my name is Stefan Mercado. We are going to demonstrate 3 exercises to strengthen and stretch the hip musculature.
We're going to demonstrate the contract, relax, PNF stretch for the hamstrings.
Next, we're going to demonstrate the hip extension exercise in the quadruped position.
And finally, demonstrate the Copenhagen adduction exercise for high-level athletes. Contract, relax, hamstring stretch. First, the patient lies supine, the knee joint is extended, while the hip is held at maximum flexion with overpressure for 10 seconds. Next, the hip is actively extended against a force executed submaximally by the investigator for 5 seconds. Then, the subject relaxes for 5 seconds. Finally, the investigator applies a stretch with hip flexion for 15 seconds in the increased range of motion. Can you push against me, please? Relax.
Quadruped hip extension with knee flexed. The starting position is with the upper body supported by the elbows and the forearms, and the knees and the elbows at approximately 90 degrees of flexion. The subject then lifts the tested lower limb up and backwards, extending the hip to 0 degrees while maintaining the knee flexed at 90. The leg is then returned to the starting position. According to A. Cerner et al., if the goal of rehab is to preferentially activate the gluteal muscles while minimizing the TFL activation, then the quadruped hip extension with knee flex exercise appears to be the most effective with a gluteal to TFL activation index of 50.
Copenhagen adduction exercise. A partner exercise where the player is lying on the ground of the non-dominant leg with one forearm as support on the floor and the other arm is placed along the body. The dominant leg is held in approximately the height of the hip of the partner, who is holding the leg with one hand supporting the ankle and the other supporting the knee. The player then raises the body from the floor and the non-dominant leg is adducted so that the feet touch each other and the body is in a straight line. The body is then lowered halfway to the ground while the foot of the non-dominant leg is lowered so that it just touches the floor without using it for support. The athlete needs a high level of core strength and stabilization prior to performing this technique.
Exercise dosing. The PNF hamstring stretch should be performed with a 10-second stretch followed by a 5-second agonist contraction, then a 5-second relaxation time, and a 15-second stretch into the knee range of motion. Should complete 3 sets of these.
Quadruped hip extension should be performed for 10 repetitions for 3 sets with a 3-second hold at the end of the concentric movement. For the Copenhagen adduction exercise, 10 repetitions should be performed for 3 sets with a 3-second hold at the end of the concentric movement.